Good morning, everyone. It's John Benko, the Director of Nursing here on the Belfair campus, welcoming you all to your orientation once again. Typically, I would be in the same location as the HR team, and I'd be talking to you from the training center as we do our Zoom orientations now during the time of COVID. But as luck would have it, today I have a vacation day, and so I'm coming to you via recording from an undisclosed location. But welcome nonetheless, and I'm here to talk to you a little bit about two things. One, what we do at the health clinic, and two, what we're doing as an agency so far as the COVID-19 virus and how we're keeping everyone safe. So first things first, the health clinic is there on the Belfair campus. Our primary responsibility is to the 90 or so clients who live on campus. We make sure they get their meds every day. If they need to be assessed for any particular condition or illness or injury, our nursing team would take care of that as well. We help to get any of those clients referred to our wellness center, where we have a mid-level provider who can provide some care for them as needed, or to any specialty providers out in the community as that would become necessary for any of those children. So in addition to those services that we do daily, we also provide some education as is needed, both to the residential team, maybe some management staff, as well as to the clients themselves. So in a very small way, that summarizes what happens at the health clinic. We're also involved with things such as the flu clinic, where we do flu vaccinations for all of the associates as well as all of our clients. Some things did change this year. As you may have heard around the world, we're in the midst of a global pandemic. So sometime around February, we were all introduced to COVID-19 or the coronavirus. Part of my responsibilities expanded at that time, where I now fill somewhat of a consultative role to senior leadership. So I help distill some of the science or information that's out there in the community and try to help develop best practices and protocols with senior leadership for both the Belfair campus as well as around all of the Wingspan affiliates. By virtue of that activity, I am in contact quite regularly with some of the larger health systems here in the greater Cleveland area, as well as some of the health authorities, the Cuyahoga County Board of Health, the Emergency Operations Management Center for Cuyahoga County, and other areas of expertise like that. So we have some great information available to us. We have a strong team of infectious disease docs who consult with us regularly. So we have some good information coming to us, and we're doing the best we can to make policies that both keep everyone safe, but also keep that essential mission-oriented focus on the services that we provide. So many of the services we provide simply cannot be suspended. Certainly nothing in residential can stop, and we also have much work that we do in the community that is imperative that it keeps going, which is why we're all essential workers and why we've weathered this COVID crisis, at least the first wave of it, by coming in and doing that work or working from home as we could. But everyone has kept the mission going, and we intend to do that. And we do that by using the best practices. So if you were to come onto campus today, or whatever day it is you first report to campus, you'll know that you'll report to a health screener. And that person will take your temperature and ask you some health questions related to the coronavirus signs or symptoms. And anyone who has any sign or symptom of the coronavirus, including a temperature of 100 degrees Fahrenheit or higher, will be asked to return home and check with their medical provider to make sure that they're free from those symptoms before they return. In addition to doing the screening and the temperature taking, we also have adopted, as many places have throughout society, a mandatory mask or face covering policy. So anytime you're out working with other coworkers or on any of the campuses or properties of Wingspan, you'll be required to wear a face covering. We do have face coverings available for you, although it is kind of hard to imagine that anyone now does not have one that they found they can use and use comfortably. We can certainly get those for you. So go through your chain of supervision, talk to your immediate supervisor or your division director, and if you need a face covering, we'll certainly make the arrangements to get that for you. In addition to helping mold some of those policies, we're also involved through the health clinic and my office with providing education on general health topics and certainly COVID-19. So we do periodic updates. Those are viewable, like this video, on the portal. So as you get information on how to access the portal for your particular area, you can see there is a COVID-19 section up in the upper right corner, and you can make yourself available to those updates as they become available as we do them. Again, we're doing them about once a week or as things change. We know that many of the policies are changing. Again, we're doing that in concert with best practice throughout the regional area, and we're doing whatever we can to mitigate the introduction of the COVID-19 virus onto our campus or any of our work sites. We have been extremely fortunate as an agency. We have had none of our residential clients become infected with COVID-19. We have had very, very few staff. Those have been managed both through leadership and through our connection with the County Board of Health or whatever residential county that employee may have been involved with. And we've mitigated the spread quite well. So that's all due to the hard efforts of everyone who reports to work for Belfair or Wingspan and any of their affiliates by following the protocols. The protocols, of course, include enhanced hand washing attention, right? We've always known that good hand hygiene is important in residential areas, and we've made an effort to make sure that everyone's aware of that. So we need to be washing our hands frequently. We need to be keeping social distance, or as I like to say, physical distance whenever possible. We want to stay 5-6 feet away from each other. We know that's not always possible, hence the face covering. So whenever you're not in the office by yourself, in a room by yourself, you should be wearing that face covering. Again, it's a mandatory policy for all properties on Wingspan and certainly the Belfair campus here in Shaker Heights. So we're doing social distancing, enhanced hygiene. We're cleaning our areas. We have our janitorial or housekeeping services who help a couple times a day sanitizing, and we're asking everyone to keep your own work areas sanitized. We have wipes available, and your chain of supervision knows how to get a hold of facilities when you need any of those supplies. So we're following all the best science to mitigate the spread of COVID-19. We'll need your help to do that, and we appreciate your help in that regard. If you have any questions, of course, talk to your supervisor or your divisional director. You can always reach out to me if you have a question about anything at the health clinic or COVID-19, and I can be reached easily via email at benkoj@wingspancg.org. I just want to take a moment to once again welcome you and thank you for taking the position that you've taken. This agency does some great work, and we do it because we have a lot of great people working there. And so you wouldn't have found this place if you didn't have a similar idea of the work that needs to be done and a drive to do it. And so we're here for you. We want to support you any way we can, and we certainly appreciate the work that you do. So good luck. Enjoy the rest of your day. As I've come in the habit of saying, in the meantime, until I see you again, please wash your hands and stop touching each other. Have a great day. Welcome.